Can I have a sip already?
Is it right?
yeah.
Of
Yeah,
course.
absolutely.
Is
I
it
didn't know if there was
recording?
a
I'm
ritual
like,
or
Yeah.
was it not recording? Like,
wasn't
it
recording
is.
before now.
Is there a way to know?
Yeah, because it's square on the thing.
Oh,
What's square?
Look at you.
What's square?
Yeah, what is square?
The red button is square now?
It looks circular to me. Oh, wow.
No, it's not filling the whole thing up anymore.
Okay. It's recording. Oh, okay. There you go. See, our youth knows our technology.
Yeah, William was...
Thankfully.
He is impressed with what you're doing with the Instagram page.
Really?
But he wants to know if you have really thought out what you're doing. And I'm like, you talk to Emily about it. He's like, I don't know, maybe she might need some, younger perspective. And I'm like,
I had a plan, and then I shifted it because I didn't like how the plan was going.
Okay.
And so I'm trying new things.
I'm happy with it.
I
We
mean,
have so many more.
In 3 days, we've gone from 0 to, we've got 20 some followers. I mean, it's like we've got
people
some
are
followers,
liking stuff all the time.
It's awesome.
And,
Okay, let me think about this for a
digital
second.
marketing class.
Oh.
So maybe I have some ideas.
I'd love it. Yeah, because you have a YouTube channel. Mm-hmm. We should talk about that.
Yeah. It's not hard to do. It's super easy.
we have like 20 followers. And we haven't even...
Yay.
It works for me.
Look at that. The owl
Boy,
and the
that is
fox. You got that
Blackberry.
out there.
I did.
Yeah, we didn't talk about the dinner. We went straight into...
I'm definitely getting like that.
Brett Kavanaugh. What? Oh, she takes notes. I refer to wine as, is this a big girl panty wine, or is this your Victoria's Secret splurge on yourself wine, or?
This is impressively good for the price. I think that's my first note.
Oh yeah.
See, this is the way to go. That has been, this, by the way, we have had this open now for 3 hours. It needed it because it was too, alcohol forward.
Yesterday?
Yeah.
We had a lot of alcohol though.
But I mean, I did a tiny little, just
Oh, wait.
when I cracked it, just to, I was like, yeah, this definitely needs some time to open up. Bring that fruit out. It's good. Okay. I'm getting rosemary. Anybody else?
I don't have that sophisticated palate. I just like it or I don't.
It's kind of mintiness.
I feel the same way.
A mintiness rosemary?
No, that I just know that I like it.
Yeah. Well, that's good.
Yeah.
Maybe a little pepper, but there are few wines that I can actually pick up the tastes or certain flowers or fruits that I'm supposed to pick up on.
Yeah.
Yeah, last night I was thinking white pepper, but definitely. It's tasty. And Sam, you're welcome to have us if you'd like to have some.
Did you write down any of
I wrote down the questions and I
that the
have
ladies had
them.
last
I
night?
have them here. Yeah. So I have so let me just Okay, yeah. We'll start light and then we'll go in from there.
You can't faze me.
Should I start light? I guess I should.
Well, you need to ease our listeners in, not necessarily ease
Go
down.
right in there.
Can we call you Becky or Dr. Becky or Dr. Lynn? What do you like? On your YouTube channel, how do people...
I'd say Dr. Lynn. So
Dr. Lynn.
Yeah, just because I try and keep it professional, even though,
But you're a friend in this conversation.
I'm a friend. You can call me Becky.
Okay. Well,
I'm probably end up calling you Dr. Becky.
let's call you
Just say
Dr.
Dr.
Becky.
Becky.
Dr. Becky.
That'll work.
That sounds like a chiropractor.
Oh, it does?
I'm so not
Dr.
a
Becky
chiropractor.
Lynn. That way people can find you.
How about Dr. Lynn? Because my name Lynn kind of sounds like a first name.
Yeah.
Let's do that.
Okay.
I apologize in advance.
Can we introduce you as Dr. Becky Lynn? That way
Yes.
they know because there's a lot of Dr. Lynn's, and then
Yes.
we can go. We
Absolutely.
can continue with Dr. Lynn from there.
Yeah.
Okay.
And at the end, can we mention my
100%.
Yeah, like all of my sites.
Yeah.
I've gotten so into this. It's kind of funny.
We want to learn from you on that because clearly you're making something work for you there, and
Hopefully.
we're in a new venture. So,
Well, yeah, I'm happy to help.
yay.
Yeah.
Talking to the microphone.
Sam is always getting such a huge education with our podcast.
How did you
Just
two
wait.
meet?
She's my gynecologist.
That's how you met? Oh, okay.
Yeah.
Yeah.
Yep.
Yeah, she had it was after cancer, and she was doing like a cancer study. No, not a cancer study, but a post effects on sexual health and cancer study. And I was like, yeah, things aren't like the same after my treatment and stuff. And so I went to go see her. And then we were sitting there talking and getting along really well. And I was like, yeah, well, Dr. Blasquez was my old doctor. She's like, well, I took his place. I'm like, well, then I guess you can be mine.
Yeah.
And just everything. It's great.
That's good.
Yeah.
It's important to have a gynecologist that you trust and are comfortable with. I still go back to Peoria because I have not found one here.
Well, this lady here, yeah,
Is the bomb, right? Yeah.
There's definitely. It was always. I enjoyed our conversations, and then it was just real. No there's no judgment.
Yeah,
and that's just
no
so,
judgment.
And I think that's hard for a lot of women when you go to see your gynecologist.
Okay, this is all stuff that we need to be saying on our show. So we're gonna have to
we have to stop.
Yeah, I know. We have these warm up sessions, and we're like, we want all of this.
And then we start. And then we start. And we go. So welcome to our show. Let's drink.
You should just do the warm up and just record everything.
I know, you're right.
Yeah.
We should.
Yeah.
That's a very good point.
Well, that's why we have that going.
Yeah, that's true.
Because
you have
we
that
can
on
grab
record. Yeah.
Yeah. So what I'll do is I'll set you guys up to have that conversation because I'll say, tell us how you two met. And then spin us right back there again.
All right.
And of course, we'll do what I do, which is introduce the wine. And then we'll go from there.
Do we want to talk about our weekend?
Yes.
Our real quick weekend. We talked about the wine and how much different it tastes now in a glass, Because last night Michelle didn't let me drink it in a glass.
Yeah, that's a really good point.
A glass.
We'll do that.
Just a little light levity.
That sounds fun. Yeah.
Gone.
Yeah, we're ready.
Gonna hear our groovy intro.
Okay.
Hi, welcome to Clitorally Speaking, the podcast. I'm Michelle Doherty.
And I'm Emily Lane.
We are BFFs dedicated to bringing you conversations between girlfriends over a bottle of wine.
Oh, I am so excited about the wine part.
Oh, me too. So pull up a chair, grab your glass,
And let's get talking.
Hey, Emily, how are you today?
I'm great. I am so glad to be back here in the studio with you.
know.
We have great wine, another amazing woman at our table that I cannot wait to hear more about. And I'm actually excited to drink this wine out of a real glass today.
Oh, you are, aren't you? Are you passing judgment on my little casual dinner last night? Listeners, when you have 10 people over for a casual dinner and it's kind of like a potluck and you don't want to do a whole lot of dishes, I'm okay with serving wine in plastic Go cups that I've collected from the Lake of the Ozarks. Anybody else? I don't see why that's a problem.
Yeah.
But Emily seems to think that the actual vessel for your wine impacts how it tastes.
It makes a difference. I mean, you know what? As you would put it, Michelle, I got my big girl panties on last night.
You did.
And I drank wine out of a plastic cup.
A plastic to-go cup from a Lake of the Ozarks bar. Of course,
did. I made it work.
I'm glad to, bring some culture into your life.
You know what's marvelous, though, is that those wines that we were drinking last night, I have since had the joy of now tasting them in a real glass.
And it's quite an impressive glass, stemware. Emily loves really cool stemware.
I have a problem, but
that's another episode. That's a whole other podcast. We're going to bring in the intervention people on that. But anyway, tell us about the wine we're having today.
It's nice. Yeah, I mean, I found the wine to be impressive last night, even in a plastic cup. So if that is your vessel of choice, go for it. But today we are actually drinking out of, I like Polish crystal. So we're drinking out of Polish crystal.
I didn't know it was Polish crystal.
Yes,
wow.
There it is. So today we are drinking a wonderful Cote De Roussilon This is from a very southern region of France. It's like in the Pyrenees. It's like almost in Spain. It's right there. So it's.
I've been there.
You have. That's our guest, Dr.
Yes.
Becky Lynn, right there chiming in. I want to hear all about
Oh,
that.
yes.
It's a beautiful region and
Wine country.
oh my gosh, I love southern France. I actually have hopes to end up there someday. That's part of the game plan.
Well, you put it out there in the universe, it'll happen.
Well, yeah, I think we need to do visit the wine country and do some podcasts there. We'll start
I'll join
there.
you.
Sure.
Yay,
Yeah.
that's
Let's all
great.
go.
Yeah.
So this particular wine, it's a Syrah and Grenache blend. It's an old vine Grenache. It's really nice. It's called Bastide Mira Flor. And of course, we will do as we always do, and we'll make sure to share this bottle with you. It is a 2015. This is impressively good for the price. You can get this bottle for $15. And I'm telling you, it tastes easily like it's a $25 bottle. You're going to get some really nice blackberry on this, a little mulberry, some black pepper. I get a little mintiness like rosemary. Every pellet's different. But I suggest give it a go. What do you ladies think?
Well, as our listeners know, my palate is not nearly as sophisticated and developed as Emily's, but it's getting there. So, on the this is a big girl panty wine. Yeah, this is like, this is a grown-up wine. This isn't your $3 bottle that you got at Aldi's, anything like that you need to pour it and drink it within 15 minutes. But that's definitely, it's like I actually feel older and more mature right now, and I've had one sip.
Hopefully not too old. No.
Well,
know,
it was really good though last night in my plastic cup,
delicious.
so I'm glad to know about
So
that.
cheers, ladies.
yeah.
Let's give this a try. Yeah.
See what Dr. Lynn has to say.
About the wine.
Yeah.
So I think it's delicious. And I was thinking to myself, it's a nice break from the cabs and pinots that my husband drinks. So that's all we happen to have in our house at all times.
Are they American cabs and pinots, or do you go old world and go French
Mostly
and-
American.
Okay.
But yeah, this is a nice sort of step away from the old normal routine.
Right.
So you were in southern France. How long ago was this?
So I was there in 2013, and we stayed in Coulier, which is just right north of Spain. And we, do you want to hear this whole story?
yeah, I want to hear the story.
So I'll try and shorten it. But when I was a kid, I had gone to summer school on the East Coast. I did Harvard summer school, and there were a lot of Europeans there because of the name. Everybody sends their kids. It was really extension school. Nothing, you didn't have to get in. Anybody could go. You write your check, you could go. But anyway, one guy that I met there, Pierre, go figure.
Yeah.
He was from Paris, but his family had a house in Coulier. So then after summer school was over, he came to my house in Los Angeles. That's where I'm from. And then he invited me back to stay with his family in their summer home. And he had a girlfriend. Like, this was totally platonic, nothing, weird. But I thought it was a really, really cool exchange. So I spent the summer in Coulier in like 92 or something crazy like that. And then my family and I were trying to pick like a really amazing trip and spend a long time in Europe. And we wanted to do that because I was diagnosed with breast cancer. And we're like, okay, live for today.
Right.
Where are we going? And we're spending a month there. So we picked Coulier out of the blue. And I actually tried to reach Pierre and I couldn't find him.
Oh.
Like, we had stayed in touch for a long time, then I couldn't find him. But we picked Coulier for that reason, just because I remembered it as being such a neat. It is, and if you love art,
Yes.
that's where like Matisse went to paint, and Dali is from
was this on the eastern side of?
yes,
Yes. Okay.
yes.
Yeah.
So yeah, the eastern side. Like Dali, his initial family house was in northern Spain, right south of the French border. So if you like art, that Coulier was such an amazing, quaint little beach town. My kids could run around. It was just great.
Oh my gosh.
Yeah.
We'll try to have a link to the Google
let's
Map
do that.
section of
Yes.
this area on our website. Dr. Lynn, did you go before you were finished treatment or after treatment or like in the middle of treatment?
It was after treatment.
After treatment.
Yes. Once I was done with treatment, like that was one of the first things that I was like, okay, kids, where are we going?
Wow.
Let's go
How
do
long
something
ago
amazing.
was that?
So I was diagnosed in 2010.
Okay.
Yep. And then I had to save the money to go away for 4 weeks in,
Right.
in southern France.
And you're cancer-free today?
Cancer-free today.
That's
Yes.
fantastic.
Knock on some wood.
Fantastic.
Now, you and Michelle met kind of through a cancer story, right, Michelle?
Well, yes.
Yeah.
Yes, I am, as our listeners are aware or not aware, I had colon cancer, diagnosed in 2013, finished my treatment up in 2014. So coming up in March, we'll have 5 years cancer-free after treatment's all over. But
Hooray.
Yeah, we will celebrate
great.
that.
Yeah,
yeah,
Well,
definitely.
that'll be a podcast.
Yeah, absolutely.
There'll be a lot of wine, a lot of big girl panties on that one.
A lot of celebrating.
A lot of celebrating. And but after chemo, I didn't have radiation, but the chemotherapy for 6 months, it does a number on your body. And Dr. Lynn had a little sign in my oncologist's exam room about a study that she was doing, or if you have had cancer and you're having like sexual issues and stuff, call the number and, set an appointment. I'm like, yeah, I kind of want to know what's going on because things have changed. And, I feel like I have sandpaper between my legs when I shouldn't be like that. And, just depressed, physiological systems, not necessarily, not depression in the brain, but more of like a physical depression. And so I went to made an appointment to see Dr. Lynn and hit it off, and we're talking, and she practices at the same practice where I had delivered all 3 of my kids.
Oh, that's perfect.
And I had said, I haven't been here since I had hysterectomy. And she looked at me, why not? I go, well, because I had hysterectomy. Why do I need to still go see a doctor? She was like, no, you still need to do that.
Still need to come.
I was like, oh, well, I didn't know that. Thanks. So listeners out there, if you've had a hysterectomy, you should still go see your
and
gynecologist.
can you help us understand why? I mean,
why?
Yeah, like what? I mean,
I just figured I had no
Yeah.
uterus, I had no cervix.
why? Oh,
why
yeah.
do I still need to go?
Yes. So you still need a pelvic exam. So, and this is a little bit controversial right now in the GYN field. So you still need a pelvic exam. Somebody needs to look at the outside of the vulva. People get melanomas on the vulva. They can have lichen sclerosis. Someone needs to look in the vagina. It's not an easy place for you to check out yourself without actually, thinking about physically getting a mirror. And then someone needs to press on your belly, do what we call a bimanual exam, feel for masses. So we're not necessarily doing a pap smear. So if you never had any abnormal paps, never had any precancers that were like CIN2 or greater, then you don't need a PAP. If you did have those precancerous cells on your cervix before your hysterectomy, that was a level 2 or greater, then we continue to do PAPs. But otherwise, we don't. But you still need that exam. And many people get confused between a pap smear and a speculum exam. And I feel like everybody thinks, a pap smear is where you go and they put a metal speculum or plastic speculum in the vagina and look. But it's not. The pap smear is actually where we take a sample of cells. We have a little spatula, a little brush that we touch the cervix, which is the opening into the uterus. We touch it, take a sample of those cells, put them in some liquid, send it off to pathologists. They take the cells and look at them under a microscope to make sure that they don't look like cancer cells. So pap smear and speculum exam are actually two completely
but they kind of go
separate
hand in
things.
hand
Because you need to have the speculum.
Exactly.
to do the pap
You can't do a pap smear without a
Right.
speculum exam. And
And
if
they always
anybody can
say,
figure out a way.
It's going to be a little cold. They always
Yes.
say, it's going to be a little cold.
Though,
Yep.
I have gone to an OBG that has warmed speculums.
We actually have warm ones.
Yeah,
'Cause you're female.
nice.
Yeah.
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 We
You
have
can
nice
get it.
tables.
Yeah.
Yeah.
So we were talking, and so I told her about who my old OBGYN was, and she said, oh, I actually took his place. He's retired. And so
Yep.
now I go see Dr. Lynn
Either one.
on an annual basis. And when we were talking about the podcast and what we want to do and with it, and I'm like, I know the perfect person to have on to talk about, women's sexual health and, talk about those the odd things that are happening or what to look for, or
Right.
so you're not ashamed. And that's one of the great things about Dr. Lynn is that she's not uncomfortable with any question, anything. You could ask her and she's like, yeah, and I think that's so
Comforting.
good and comforting for women because you're already embarrassed. You're like, oh, well, I have this possible thing. Or they don't mention it because
Right.
they're afraid there'll be judgment.
Right.
Oh, you
Right.
whore,
Right. Right.
You had sex 3 times with those babies. Oh, and of course this is happening to you, and so
Right.
you do not give that kind of demeanor at all. So
What do you think is maybe one of the more common questions that women ask that they're afraid to ask? That's just like, oh, this is, something every woman goes through.
Well, I think it's more that the problems I treat, women are afraid to ask about, or they think they're the only person with that problem, that something is truly, mortally wrong with them. So painful sex, I see a lot of painful sex, and there's a variety of different reasons that people can have pain. It can be menopause, it could be vulvodynia. But
What's vulvodynia?
So vulvodynia is where you have pain in the vulva, which is the outside of the vagina, and you don't have a reason. So there's no lesion, there's no blister, there's, everything looks completely normal, but you can just have pain in the vulva.
Is that something that happens after? Is it something that either you always have this problem, or is something that transpires?
Triggers it.
Right.
Yeah. So it can be both. Some people will say, I've never been able to wear tampons. I can't wear tight pants because I always feel uncomfortable. They tend to describe it as a burning feeling. They've been treated, several times for a yeast infection and they never get better. Or it can be something that pops up after some sort of event, like a really bad yeast infection. And then they itched and scratched and broke the skin. And then now they have constant pain, but they don't have a yeast infection anymore.
So it's an external, it's not an internal pain.
Yeah, it's a vulvar thing.
Okay,
Yeah,
so it's an external.
Yep. And it also is something that travels with people who have chronic pelvic pain. So there's a variety of different, different problems that women can have that tend to travel in packs. So endometriosis, interstitial cystitis, which is painful bladder syndrome, irritable bowel syndrome, pelvic floor muscle spasm, and vulvodynia. And sometimes people have fibromyalgia or migraines, and anxiety and depression definitely go along with those.
Wow.
Well, if you have all of those things, I can see where you would be
Exactly.
depressed.
Yeah, which
and
came
have
first?
anxiety,
Yeah,
right?
the chicken or the egg.
Right.
But the key...
But you don't have to have all of those.
No,
any
no.
of those. Okay.
People will have maybe 1 or 2, and then somebody else will have a different 2.
Okay.
And the key to treatment is to treat all of the issues, not just one.
Okay.
Because if you only treat one, they won't get better.
Wow. And women historically are afraid to come in and talk about painful sex because they're embarrassed about it, or they don't talk. We don't share. We don't share
Right.
about it. Even
Right.
I mean, we talk about a lot of things over wine, and sometimes we'll bring up some sex, but it is one of those things where we don't, especially as we've gotten older, we just sort of navigate. Oh, okay, I guess this is what it's like to be menopausal, and it sucks.
And it depends on who you are, too. Some women are very open about their sexuality, and some women are very not open. So, the older you are, I see women in their 80s who come to me because maybe they have a new partner and they want to be intimate with their partner. But some women have a very hard time talking about it, and other women are like, I'm here because, this is going on, and how can you fix me? And so it's such a broad spectrum of people's comfort level, but I would say in general, the older you are, the less likely you are to feel comfortable talking about it. The younger women tend to feel more comfortable talking about it, but not everybody, because it has to do with your upbringing. It has to do with your religion. It has to do with a lot of things and what you were taught from your parents about sex. Is it a negative thing? Is it a bad thing? That, and then also, as far as menopausal women, they tend to have vaginal dryness that causes painful intercourse, but they're not aware that it's related to menopause because it tends to show up about 5 years after you stop having periods. So we all know hot flashes are due to menopause, that woman going, whew, it's hot,
Right.
whatever.
Yeah.
But and those happen right around the time your periods get wacky and then your period goes away. But the vaginal dryness doesn't happen till like 5 years later. So I will hear women come in and say, oh my gosh, my partner thinks there's something wrong with me. He or she thinks I'm cheating because I don't get lubricated, or what's wrong with me? And it's very traumatizing.
I mean, there are sections of the grocery store and, of Walgreens that are carved out for lubrication. I mean, clearly there are...
Yeah, but I will have to say that as a woman in menopause who has had cancer, has had treatment, who after I shouldn't really refer to myself in the third person, but I'll just blame it on the Grenache. But after the surgery, and I went down to like one ovary, and I didn't know that the ovaries work every other month, but they removed one. And so they're like, yeah, it's going to be about 6 weeks and things will get, back in order. And I literally, it was like sandpaper between my legs. There was no lubrication. And it was the worst. And
that's how people describe it, sandpaper.
Sandpaper. And I would never I never would think to look at Walgreens at that section
really?
Because that lubrication in my mind was for sex. You need the KY for when you're having sex with your partner, you need that extra for sex, not thinking, that there's products out there to help you with your day-to-day.
Well, there's a difference between moisturizers and lubricants, although some can be used interchangeably. So most of those that you see at Walgreens and whatnot are lubricants for use at for use at the time of sex.
Yeah.
But the majority of them are water-based. And there's usually maybe one or two that are silicone-based. And if you're menopausal and you're not using condoms, you want to go with the silicone-based and not the water-based. The water-based are good if you're using condoms because they don't affect the integrity of a condom. And it sounds funny. People are like, oh, I picked the water-based because it's natural. Well, cocaine is natural, too, and it's not good for you. So
that's surprising. I hear silicone, and I'm thinking people have silicone.
Chemicals, right? Yeah,
right.
no. So, and this is for a menopausal woman because the water-based ones, they draw the moisture out of the vagina. They really take the moisture away.
Oh my goodness.
So I recommend silicone-based, and if that gives you the heebie-jeebies because it's not natural, you can also use olive oil.
Which
wow.
I have to say, it sounds so incredible with the olive oil. And yes, listeners, I've experimented with olive oil, and I told my partner it was fine to bring the olive oil.
Are you extra virgin olive oil?
I'm an extra virgin. I'm an extra virgin olive oil. But I said, please make sure that you bring a big baguette with you. And we can dip the big baguette into the olive oil, right? Yeah. And fortunately, he had a very good sense of humor.
So
Right.
this is curious to me. So I'm just kind of surprised that there's just day-to-day lubrication, even when you're not having intercourse, that people are missing and have a need to fulfill. So
Right. So when you have vaginal...
People don't
talk
this.
about it.
Yeah.
I know. That's why I'm here to
Yeah.
spread the word.
That's why we are clitorally speaking.
Yes. So you can also moisturize the vagina. So lubricant is for during sex, and moisturizers are just on a regular basis. Just like, you go to the bathroom, you wash your hands, you take a pump of lotion and you rub it in. So you can do the same thing to the vagina. And there's a variety of moisturizers on the market, or you can use Crisco or coconut oil. So that sometimes freaks people out. Like somebody said to me, "Well, that's like my fried chicken." And I'm like, I mean, yeah, seriously. They're like, well, let's not think about it that way.
Coconut oil smells
But
good.
not Vaseline.
No, Vaseline isn't really recommended.
Okay,
Yeah, you can use it if it doesn't irritate you.
Okay.
You can use anything if it doesn't irritate you. But the things that tend to be the least irritating are like Crisco, solid coconut oil. And just like you would put lotion on your hands, you can take a scoop and put it on the outside of the vagina. You can do it twice a day. You can do it every time you pee. Because women who have like serious vaginal dryness, they feel it when they wipe.
Yes.
Like it's just dry. Or they're riding a bicycle and they're like dying because it's so dry.
You don't think about it when you're younger. You're like,
'cause
right.
it's like-
it's just
you're like-
all the time. Like, wow. Gosh.
Yeah, I remember thinking like, is this normal? Like
Right.
how what? You know, you
Right.
are
It's all
as a-
about the discharge. When you're younger, you're like, what is this?
And now you're like, I just want a discharge. Just
know.
give me anything, you know? Like,
Yes.
can I order it on Amazon? Just some discharge.
Now there's an idea for all those postmenopausal women out there.
Oh my gosh.
Having
yeah.
it delivered, in a
Honey, did my discharge arrive today?
I think there's something here.
we're gonna have
Sorry,
to use
dear.
a lubricant.
Break out the Crisco.
I've got the olive oil. I bought the gallon can from Costco. We're gonna get lucky.
Oh my gosh. Well, on that note, I think this might be a really good time for us to take a quick pause and refresh our glasses, and we'll be back in just a moment.
All right. Sam is turned away during this episode.
That's the most times I've heard the word discharge in 1 second span, I think.
I think we're ready for some of the heavier questions that we have coming in now. So, yeah.
You're having a lipstick issue today.
And that is so funny.
Yeah, it's gone.
Yeah.
I did have one patient come in and say, Dr. Lynn, I'm tired of feeling like a salad. Like, because of olive oil. I'm like, okay.
See, I wish we had that on our
Sorry.
No.
It's okay.
No, it's good. Well,
Yeah.
you know what? We have it for the outtakes,
Yeah.
right? Yeah.
Yes,
Put in-
outtakes.
Do you need a refresher on your glass?
I can't really drink too much because I have to drive home.
That's true. Yeah,
Yeah.
we're proponents of Lyft and Uber.
Yeah, I thought about taking Uber,
Yeah.
but I didn't.
Don't you live too far?
No, I live on McKnight behind the Galleria.
Oh, yeah.
Yeah,
okay,
it's
great.
really close.
All right.
We are.
Yeah. Do you want to bring us back in? Or should I?
You bring us back in.
Okay, you got it.
Yeah.
All right, we are back. We have fresh glasses. Thank you for joining us at Clitorally Speaking, the podcast. We are here with Dr. Becky Lynn, and we are talking women's health issues.
Women's sexual health.
That's correct.
Yes.
Yeah, thank you for adding that.
Focusing
Yes.
you on the topic.
Yeah, well, I have had a glass of wine right now, so my focus is a little fuzzy. But so as we were on a pause, Dr. Lynn shared a kind of a funny story because we were talking about lubrication and how that shifts for women that are in menopause, and well, we'll just let you two carry that on. There was a cute story.
Right. We were nobody's just joining us because it's not like we're on live radio or anything like that. But we were discussing discharge, and I said that for Sam,
Yeah.
our audio engineer, because he was commenting on how many times we'd already said that word. But we were
Yes.
talking about that and ways to stay lubricated as you get older and you're dealing with menopausal issues. And you were talking about a patient of yours that had come
Funny
in.
comment. So, I recommend olive oil often as a lubricant. So she came in and she said, Dr. Lynn, I'm tired of feeling like a salad. And I'm like, what? She didn't want to use the olive oil anymore. So,
Yeah, well, then you transitioned her to some other product or
a silicone-based lubricant.
Yeah.
So, I get no kickbacks from the companies, but I usually recommend Platinum Wet or Uber Lube. But if you go on Amazon, there are plenty of different lubricants,
That
silicone-based
can be
lubes.
hard to navigate. It really,
Yep.
because there are so many.
Yes.
Yeah.
So actually, I have a web page called Women's Sensual Health. It's not my page, actually. It's a company that does this. But I choose the things that I recommend, and women can purchase from that website. I don't get any money from it. The company gets the money, but then 10% of the proceeds go to Gateway to Hope. That's what I've designated as the charity. And Gateway to Hope is a fantastic charity here in St. Louis that provides, that pays for health insurance premiums for women with breast cancer who have no health insurance
Nice.
or who are underinsured. And then it also pays like rent, utilities,
Oh, that's
rides
great.
to your doctor's appointment, which I think is amazing and fantastic. So that's Gateway to Hope. It's an amazing
We'll make
thing.
sure to share a link to that.
Yeah.
Yeah.
Because the last thing you want with a diagnosis of cancer is to be like, I can't go to the doctor, or I'm going to have massive bills and financial stress because I don't have insurance. So
Or even if you do have insurance.
still stressful.
It's still stressful, and you still
Yes.
had massive bills. And
Yep.
it's still, I think last year I finally paid off because of my insurance plan at the time, I was responsible for 3 of my chemo treatments. So
Yikes.
that was about $5,000 total.
Oh my gosh.
And I finally finished paying that off. But that's a whole nother podcast and a rant and rave. And I feel very passionately that people with cancer are taken advantage of by the system, because you are facing a diagnosis that could be terminal, could be the end, right? And you don't want to die, and you're just doing everything you possibly can.
Right.
You're following your doctor's orders. You're going here, you're going there. You're take this test, that test, shoot you up, whatever, and you got to
do it. That's what your doctors are saying.
Right. Yeah. But on the other side of that door is the billing department, is the administrative side, and they are ruthless. And it is, and I don't think it needs to be.
Well, I'm happy to come back and talk about what I think about universal health care and how we are the richest country in the world. But then we have people who can't go to the doctor because they don't have health insurance, or they don't because they're afraid of bills. So then there's a delay in diagnosis. So it drives me crazy.
Yeah, and just the cost of health insurance. I mean, it's astounding.
It's ridiculous.
Yeah.
It doesn't need to be that way. And that's the thing that's frustrating. I think we all agree here that it doesn't need to be that way. But there are folks that like to keep it that way, to keep it down. Why have everybody why in the world would we want our country to be full of healthy, happy people? I mean, where would that get us?
Right.
Yeah. I mean, that's like a crazy idea.
Well,
anyway,
I definitely want to have you back to talk about that. But, we knew that you were coming, and we have a really nice circle of amazing women that are friends. And so in preparation for this podcast, we asked our girlfriends, like, hey, Dr. Lynn is coming on. Do you have any question that, you would love to have answered that maybe you're a little nervous to ask your normal doctor? So I have some here. And are you ready? As she fans.
I'm ready.
Okay.
Sorry, it's a little hot in here.
It is a little
I was
hot.
looking for like a magazine.
You know what Sam can do to
That's
help
okay.
with
We'll
the
keep going.
temperature.
I'll manage.
Well, so we have a couple of friends of ours are actually young widows. We have more than one friend that's in this position. And
Unfortunately.
That's sad.
And they were like, is there such a thing as vagina sadness? Like, can a vagina apathy after a certain amount of time that, you haven't engaged in intercourse? Is this an emotional response? Is it physical?
Is it an urban legend?
Yeah. So the vagina is a use it or lose it type organ.
It is?
It is. But
Okay.
in a young person who has hormones around, once they start having sex again, it'll just go back to normal. Where it really becomes a problem is in postmenopausal women, where the vagina without hormones, and they're not using it, they're not bringing blood flow to the area, the vagina can get shorter, it can get smaller, and sex can become really painful. But there's treatment. There are plenty of things you can do to restore the vagina. Oh, that's much better. I feel the air.
Yeah.
We have some air going.
Thank you.
Yeah.
But,
all this vagina talk just got
make me hot.
the whole room was just hot.
But for a young woman, even if they haven't had sex in a while, they'll get back into the swing of things. So if they're having regular periods, then we know that their estrogen levels are fine. And, the first time may be a little uncomfortable, but they can get it back pretty easily.
What do you consider a young woman?
Premenopausal, I would say. Now, in your 40s, your estrogen levels begin to decline to a point where some women in their 40s, even before their periods go away, start having problems with vaginal dryness. So, the younger you are, the quicker you'll get back into the swing of things. When you're late 40s, your estrogen levels are lower. It might take a little bit more time, or you might need to use an intravaginal estrogen or intravaginal DHEA, which gets converted to estrogen and testosterone, which helps provide lubrication and elasticity. So, one of the things about the premenopausal vagina is Oh, here's a good thing. So premenopausal vagina is like the tissue's thick, it's moist, it self-lubricates, and it stretches. It has elasticity. And it's got these rugae, which are little folds in the vaginal tissue that help it stretch. So you can have a penis in it and a baby come out. That's what it's for.
Not at the same time. That's a little difficult.
Not at the same time,
The
no.
doctors do not.
I would have to tell the guy to move out of my way so I can catch the baby.
Yeah.
But
They always want to be first, right? The guys are like, no, me first, right? You're like, really? Does it have to be about you today? She's given birth. I know. Can you just wait? I know.
So the postmenopausal vagina is very thin, it's dry, and it loses those rugae, those wrinkles. So I always say the
Is that
vagina.
visible? Can you see that?
Yeah.
On the speculum
You can see it
exam.
on the speculum, and some people will see the little rugae and they'll come in and be like, I got a bump there, and it's just the little folds of the vagina. But a postmenopausal vagina loses the wrinkles, those rugae. And so I always say the vagina is the only organ that gets less wrinkled as we age.
Can that be
Not
fixed?
fair.
Like, I mean, goodness, like
Absolutely.
women were doing. Yeah, I was gonna say like we could probably inject.
Why would you want to inject anything
Wrinkles.
into it?
Well,
I mean, is there
for comfort?
Well,
right?
so the wrinkles allow it to stretch, but really all you have to do is give it the hormones back.
Okay.
Oh.
Yeah, you just give the hormones in the vagina. So when you give intravaginal hormones, you don't have a lot of the risks that you do if you like swallow a pill of estrogen and progesterone or estrogen alone, risk, or increased risk of blood clot, heart attack, stroke, breast cancer with estrogen and progesterone together. But if you use it in the vagina, then you just don't have to worry about those risks. There's one product that's a pill that is designed to help the vagina lubricate, but that has systemic side effects. It causes hot flashes. It increases your risk for blood clot and stroke. So it's not one of my favorites.
No.
So the application of this internal hormone, is it kind of like a tampon? Like,
So there are different ways you can do it. Well, it's either an applicator or with your finger. So there's a variety of products. And actually, within the last year, there have been 2 new products, which I'm so excited about because for the longest time, we only had certain options and they were all very expensive, which was highly unfortunate, going back to the cost of medicine. But in the last year, we've come out with intravaginal DHEA and a new estradiol formulation. And the intravaginal DHEA is $25 a month, and the estradiol is $35 a month, which is so reasonable. Whereas some of the older creams that have been around for a long time are like $200 a month.
Well, and unless you go outside the country to have it come.
Yes.
And then it's
Yes.
like $30 for 3 months. But I did try the $25 a month one, and I was loving it, and it was like, this is the best thing since Bastide Mira Flor's red wine from the
South of France.
But I found after about using it for maybe a month, I had a reaction that was similar to years ago when I did the NuvaRing. And I was like, I was fine. NuvaRing, good, everything's fine. Oh, it's all good. Then one day I woke up and I had I was on fire down there between my legs. And the only thing I could do, I took the NuvaRing out, and then everything settled down, right? I was like, oh, I must be allergic to whatever's in the NuvaRing or in what they make it.
Right.
And so it was the same thing. Take the $25 one, use it. Oh, this is good. I can pee and I can walk around. It doesn't hurt. I can sit down. Oh, she's very happy. She's happy now. And then I woke up one day, same pain.
Oh, no.
And I'm like, I haven't used it since because I think there's something in the wax,
like
or
the vehicle that it comes in.
Yes,
Well, it's
yes.
palm oil, the vehicle that it comes in.
No
It's like based in palm oil. It's called
This was the
I can't remember.
Intra-Rosa stuff.
Yeah, the Intra-Rosa.
Yeah. So I don't know the other thing, the $35 one. And I'd
that
have
one's
to look,
Invexi.
I'd have to look and see.
Kind of like I'm sexy. That's where the name came from. Invexi.
yeah.
Cha-ching.
Yeah. So I'll, I'm going to see you in a couple months.
Okay.
For my annual checkup, and we'll.
But we can chat before if you don't want to wait. Because sandpaper
wait
is no
months.
fun.
Yeah, because all of our listeners out there are so worried about Michelle's sandpaper feeling, and they're gonna be like, "Did she get the $35 prescription? Come on, please!" And I'll report back, listeners. I will definitely.
That will be.
And we'll be like,
that will
"She's
be
a happy
exciting.
girl.
Yeah.
She must have her $35 a month prescription."
I cannot wait to see our Facebook recommendations that come in. Yeah. For people saying, "Oh, have you tried this lubricant?" Or,
Michelle did. Michelle
Yeah.
had this issue. Yeah. Well, with great power comes great responsibility. That's what we say here at the Clearly Speaking the podcast.
All right. So I have another question for you.
Sure.
And this kind of goes back to, I'd say, my early days. This came up at the table the other night, and I was like, I can relate to this question. So it has to do with, like, does your vagina actually, like, take shape of your partner? And because I remember, like, I mentioned this in a previous podcast, that like my first experience was with somebody that was like had a micro penis, right? And then
I hope he's not listening.
Right.
We decided, we took a poll and a vote, and they said that didn't count. So it wasn't
didn't count.
Yeah, it didn't count as her first time.
And then the next person that I was with for a long time, but it was very painful in the beginning, and it was, my friends were like, oh, well, that's because your first guy was so small, and your vagina it knew that, So anyway,
old
I'm
wives'
sure that's
tale,
a myth, right?
yeah. Mm-hmm.
So, but as we, does it change size based on who you're with and with exercise and all those things?
Childbirth affects it. So, yeah.
Did you see the size of my son's head?
I thought you were going to ask me something else there. No, childbirth definitely affects it. You can have vaginal laxity. Don't laugh, but sometimes we call it like a gaping vagina, where if you've had several large children, the opening, which is called the introitus, like if you look at a virginal woman, it's small. And after several children, it's like open, it's gaping.
Mm-hmm.
So, and some women will complain that they don't have that friction with intercourse with sex. So it's just gotten too wide and too lax from having a lot of babies that they don't get as much pleasure out of sex.
Right.
So,
And do you just recommend do your Kegels?
So, yes, you can do your Kegels, but there have been a couple studies looking at using radio frequency for vaginal laxity. And there is a device called Vivive that has a randomized, double-blind, placebo-controlled trial, which is hard to come by when it comes to some of these devices, that shows that sexual satisfaction and laxity, like women's perception of their own laxity, gets better after the radio frequency treatment. Mm-hmm. Yeah. So the study was done in Canada, and I think it was there were a couple other sites, and they're currently doing that same study in the U.S., I believe, with the hopes of getting it FDA approved for that indication, because, besides Kegels, before the radio frequency device, you could have surgery. But if you have surgery, like, you could end up with painful sex just from scar tissue.
Yeah.
So this is, kind of that middle ground. So we're waiting patiently for that next trial to come out.
So surgery, that's the, like, vaginal rejuvenation.
The vaginal rejuvenation, vaginal rejuvenation is not a medical term. It's sort of this wastebasket term, and depending on who you ask, that if you ask one person, they'll tell you it's one thing. If you ask another one, they'll tell you it's others. But it's sort of a combination of using laser and radio frequency to either treat medical conditions like vaginal dryness, you can treat with a laser, or to make things look prettier. And so plastic surgeons do a lot of this vaginal rejuvenation.
And who is it looking prettier for?
Exactly.
That's my thing.
So here's my theory on that. When I first went into practice, everybody had pubic hair. Right. And over time, people are shaving their pubic hair. And sometimes I get young women that say, I'm sorry I didn't shave. I'm like, you don't have to shave. It's there for a reason. Yeah. And so now that things are shaved, women are looking and they see, oh, this labia is longer than that labia. Oh my gosh, something's wrong with me. Or they're embarrassed, or it's,
men can be insensitive about the gift that they are receiving.
Right. And
so do you think
so
that's a trend that is problematic?
So I go back and forth because part of me says, oh, come on, we're asymmetric. Some women have one breast that's bigger than the other. If you put a mirror on our face right here, this side of us will look different from this side of us. But then by the same token, if a woman wants a breast augmentation, do I have a problem with that? No. if it's a confidence builder, maybe she, was very flat chested and it bothered her. And so why can't she choose to get a breast augmentation? So why can't you choose to get a labioplasty to make them look even? I don't know. I mean,
does it give them any more pleasure for sex?
no, it's not for pleasure.
Yeah,
no,
I would
it doesn't
think-
give them any more pleasure at all.
What about the hair versus no hair? Do you feel that
should
is
have
a
hair.
trend? Yeah.
Oh, that's definitely a trend.
But
yeah.
then there's a reason God gave you hair.
Right. And it helps, prevent infection, provides warmth. I mean, there's a reason that you have pubic hair. But I feel like I'm very biased in that respect a little bit, maybe because I'm the older generation. So I'm like, you should all have pubic hair. Where did it go? And also, I think, now I'm just going to say this here on your website or your podcast, but, what I think is women who are completely shaved look like children.
Right.
And I find that a little
Disturbing.
A little disturbing.
Yeah.
And I think part of that comes from the fact that, pornography is easily accessible. And I have nothing against pornography. It can be used in a healthy way. It can be used in an unhealthy way. But I just can't help but think that that's where that trend started, because you definitely see it on pornography. Shaved, shaved, shaved. So, but it does to me from the older generation. Oh, I hate to say that. I'm like, it looks like a child. So
It does. It does. And, I'm all for keeping things nice and trim and clean and scaped, if you will. But if I
scissors.
but it's a complete turnoff for me if I come across, a partner who has shaved.
Yeah.
And I'm like, I don't want to be with a little boy.
Right. But it's a trend now in men.
Well,
It is.
It is.
Yeah.
It is.
I wonder how that
Well, it makes them
caught
look
on.
bigger.
Oh,
Yeah.
well, okay, that makes more sense then. I never really thought about it that way.
On that note, is it maybe time for one more last refresh?
Oh, sure.
before we-
Absolutely. Yeah.
Yeah.
This is always a good time to stop.
Yeah.
Take a break.
Time to have a little glass refresh, and we'll be right back.
Too funny.
I like it though. It's fun.
Would you like a little more?
No, I'm
Okay.
good.
All right.
I'm good. I do
Sam,
have
would
to
you like
drive
a little
home,
refresh?
and I have to go to bed early.
Okay, what's our
past my bedtime.
last round? What should we?
Well, were there
focus
any
on?
really hardcore questions or anything?
I had a question that was right here in the middle of you had
The vagina
atrophy.
sadness.
Oh, vagina sadness. Now I haven't heard of that.
Yeah, which we talked about, which was the atrophy and the loosen and tighten bit. Mish had a question about she feels like there's this almost it looks like a scar that's now on her belly. Like there's a fat and a scar, and she's a very physically fit woman, and she remembers when she was young seeing a very physically fit woman that had the same issue. That was she's all muscle, but she's got this
Little pooch.
yeah.
Yeah.
Is
So
that something? Yeah. Okay. So then we'll
Okay,
bring
we can
in
talk
with
about that.
Yeah. Is there maybe something
Oh, I
heavy
know,
that
I
we
know.
should ask?
I know.
No.
I'll make a note.
You got it. Okay.
Sex for pleasure in women and why when you have I'll formulate it
okay.
because you talk about the vaginal rejuvenation, the labiaplasty,
Yeah.
and these are things that don't increase any pleasure, but sex should be ideally sex should be pleasurable, and beyond sex should just not be painful.
Right. It should be
It
pleasurable,
should be
for
pleasurable
women.
for
yes.
women.
Yeah.
So kind of want to talk
So
about
it'd be interesting to actually I'd be interested. We all hear about the G spot. It's different for different people. Is that an actual, what
Is it an
the
actual
G-spot, right? Is that
Not really, but yes. I mean, so I can talk about it.
Yeah. Okay. Good. All right. This is.
and then masturbation, I guess,
Yeah.
self pleasure.
Absolutely.
Okay.
Sex for one.
All right.
I don't have any
got
complaints
some
in having
topics.
sex for one.
Me neither.
So.
Everybody does it. They just don't talk about it like men.
Right.
It's true.
Yeah.
we don't walk around bragging how many
Right,
times we jacked
right.
off in the bathroom the
I
other
know.
day. Yeah. I was
Okay,
like,
he tuned out.
yeah, woke up, took a shower, jacked off, came home, jacked off.
Jacked off again.
You know, before dinner, jacked off.
Watched some porn.
Oh, I'm a man. And then I manscaped and I shaved it off.
Right. And then I thought, wow, I look hot, so I jacked off again.
I'm going to do myself one more time today. Because, I'm a man and I like beer. I like lots of beer.
Oh my
Oh my gosh.
Oh,
I need a copy of that.
right.
This is hysterical.
absolutely.
It's raw. It's true. It's
Raw
real
is
women.
good.
Real
Yeah.
talk.
Yes.
All right, let's bring us back in.
Are we ready? And we're back.
All right, here we are. So, I have a few more questions, if you don't mind,
Sure.
and then we'll let it kind of
We'll finish our
go
wine.
from
and-
there. Yeah.
Yeah.
So, a friend of ours was talking about how she's now in her mid-50s and postmenopausal.
Mm-hmm.
And she's very physically fit, but yet she's noticing that all of a sudden on her belly, there's this area that's, it's poochy. It looks like there's a scar there. And she was also mentioning, she remembered when she was young and she was, on a beach and she saw this woman who was very attractive, very physically fit. And yet there she was with this pooch and this scar-like,
near the belly button area?
Below.
Below,
And
okay.
and she was like, oh, she must have had some sort of operation. But now that she is of this age and this is happening and she's exercising and everything she's doing, she can't get rid of this. What is this? And
Yeah.
what can be done?
So it's highly unfortunate that when you go through menopause and you don't have a lot of estrogen around, you begin to deposit fat in places that you didn't before. So being a woman and having estrogen, you deposit fat, on your hips, your butt, your breasts. And then when you go through menopause, you just don't have as much estrogen around. So now you develop that little pooch. It goes right to your middle, just like a guy.
Okay, so it's cellulite, basically.
no,
That scar.
So
Yeah.
the scar area, if it's not truly a scar, if there's never been surgery there, what I'm guessing that it is that fold. Because if you have babies, the skin gets stretched out, and then people will have this little kind
Yeah.
of roll, just
Yeah.
because you can't make that skin go away once you've been pregnant.
I
So that's
see.
that's my guess.
Okay, so
Yeah, there's a
Oh, well.
thickening that happens around
it's
the middle.
wisdom.
Yes,
It's the
thickening
wisdom
around
ring.
the wisdom ring. Oh, I don't like my wisdom ring. We're not friends.
I have a wisdom barrel. Did I tell you? Did you see the size of my son's head? Yeah, he's, I've had 3 babies.
It just means he's really smart.
They're all of my
All
children
very
are very,
smart,
very
yes.
smart. No,
Yeah.
yeah, absolutely.
Have you come across women that have made the decision to have a C-section because they were concerned about?
Vaginal preservation.
Yeah.
So occasionally I will have a woman come and say, well, I just want a C-section. But then I talk to them about the risks of having a C-section, what it means for future pregnancies, and I discourage it unless they have a medical reason to have a C-section. Now, ultimately, if a woman says that's what I want, I will do it for her. But I don't think you can make that decision without being completely informed about the risks, because once you have a C-section, then you have to make the decision in your next pregnancy. Do you want a C-section or vaginal? If you do repeat C-sections and you end up having several kids, with each C-section, you create more scar tissue. You can have a placenta that grows into the bladder.
Oh my
and
gosh.
you end up with a hysterectomy, and then you end up in the ICU, and then you get lung problems and sepsis. And it's not a decision that I think can be taken lightly. And I do feel that once I explain where this is going, most people are like, oh, okay, maybe I don't really want to
and
do a
there's-
C-section just for a C-section.
And there's so many amazing benefits through a natural vaginal birth, like there's the bacteria, right? That
Yep, the bacteria in the vagina
right, that
and
your baby when
right. like populates the, I mean, I
Right.
can't tell you the details on that
Protect-
one because I don't do that
builds
much
their immune
obstetrics anymore.
system. Yeah,
But
it's
yes,
amazing.
yeah, because now I can't even mention it because I don't even know
We're
the
gonna
details.
get confused.
Yes,
Yeah, I'm gonna-
go
yeah.
down a new
Confused. Yeah,
track.
but there's a thing called Google out there, and you can look it up.
Right.
Anybody who's out there, I had 2 vaginal births and 1 C-section. My son, who's 15, he was a C-section, and I had labored all day.
Was he your first one?
He was my third.
Oh, he was your third one.
He was my
Okay.
third, and
That's
we had
good.
induced him a week early because Dr. Blaskowitz was going out of the country, and I wanted him to, deliver him, and I labored all day.
Yeah.
and he wouldn't stay. He just bounced around. He was having a good old time, and Dr. B was like, "Well, we can turn this off and resume this tomorrow, or we can have a C-section." And I was like.
Get him out.
C-section. And I'm very grateful that I did because he was born Frank Breech. So like butt and back first.
But wait, when you were laboring, he was head down?
He would go head down, then he would bounce back up. He was
a swimmer.
and he was 9 pounds.
Oh, he was big
Oh,
baby.
my
He was a big
Lord.
baby.
Yes.
A very big baby. And I was like, yeah, I mean, the C-section was odd. It was an odd feeling. I
Right.
felt like I was a tube of toothpaste being like squeezed. Like when you're trying to get
Oh,
the last bit
yeah.
out. I
Yes.
just felt like that's what was happening to me. And my
That's
mom was
interesting.
like looking over, going, "Well, they got this," and they said she was like, "Oh, doc, his hand's really up inside you," because William,
Yeah.
that's my son's name, he wouldn't let go of my liver.
Oh,
So they had to go in and get his little fingers off my liver and pull him out. And then, of course, because he didn't go through the vaginal canal,
Right.
they get things squeezed
Squeezed
out of
out,
him.
the fluid squeezed
he didn't,
out, yeah.
He didn't cough right away or anything like that. And so they ran him off to the NICU, but he was fine. He was fine. And then I had to recover from a C-section. And that surgery recovery was worse than the hysterectomy, worse than my colon cancer. To recover
Really?
from that abdominal surgery.
Wow.
And that was 15 years ago. So, but anyway,
well, it's major surgery.
It is major surgery.
Yeah.
Yep.
yeah. And as usual, I like to talk about myself and things I've gone through here on this podcast.
All right, I have another question for you, Dr.
Sure.
Lynn. So I have this awesome book. It's from like 1911. And it talks about the female orgasm. It's a myth. Okay, we all here know
No,
it's
the
not
female
a myth.
orgasm's not a
right?
myth.
We know this.
Thank goodness
That's why,
for that.
Right.
Yeah.
That's why I love this book. It's just very like, oh, yeah. Anyway, and it got me kind of thinking, like, okay, the female orgasm, definitely not a myth. In fact, we can have all kinds of different types of orgasms, right? There's the clitoral orgasm. There's the orgasm that's coming from a little bit more on the inside, the
Vaginal penetration or fingering.
Right. So what is actually happening there? Are there multiple spots that induce this kind of pleasure? And what is, there's debates, like what is the fluid? Like if there's somebody that has the
yes.
G-spot orgasm,
That's like-
what is that?
Oh, she squirted. I'm like, what the hell? Right?
Yeah. So, okay. So, couple questions to
Science.
answer here. So, typically, there are 2 main types of orgasm that women have. One is from clitoral stimulation, and one is from vaginal penetration or fingering. And part of the reason that there's a variety of these is they're all clitoral orgasms. So, the clitoris that you see, the little nubbin that you can see or feel yourself, is only a fraction of the clitoris. So, the clitoris extends back. It extends along the anterior vaginal wall. So like kind of the vagina is like a long hollow tube, kind of the top of the tube towards your belly button. And then it extends around the introitus. So most women can have a clitoral orgasm. Fewer women can have a vaginal orgasm, like from vaginal penetration with anything.
Yeah.
And part of that is because you can touch the clitoris directly where it is externally. Whereas, vaginal, you don't have that direct connection to the clitoris. But so then they talk about the G-spot, right? So they've done studies where they've like dissected cadavers and looked at the tissue where we think this G-spot is. And there's no difference. There's no like little button up there that
Right.
says press here. Like there's no actual G spot. But the thought is
It's an H, actually. It's the H spot. It's the wrong letter
Right,
of the
exactly.
alphabet. Yeah. Do you think they designed that, like, this whole myth and theory is to make a woman feel inadequate because she's not having a vaginal orgasm?
No, because what I think about the G spot is that, it's the anterior vagina has some of the clitoris. And then there's a lot of talk about the female prostate, where women don't really have a prostate, but surrounding the urethra and that clitoral area, that's when you talk about squirting, right? So it's kind of like fluids that, some people say that G-spot encompasses the female prostate, the glandular tissue that makes secretions.
Okay.
And so when women talk about squirting, some women can actually ejaculate sort of prostatic fluid. Because we're all the same.
Yeah.
If you are XY, those same tissues, we all start out the same.
Right.
If you're XY, you form a penis and a prostate. If you're female, you form a clitoris, which is analogous to the penis.
Right.
And then this female prostate, it has similar functions. It's just not like an actual prostate. So when you squirt, you can have prostatic fluid that you squirt. But some women also leak urine when they have an orgasm. They lose their bladder control. So it's hard to tell if you are a true squirter or if you're just leaking urine. But one way that you can tell is to use the pyridium that you can get over the counter that turns your pee orange. So if you squirt and it's orange, it's urine. Yeah.
But what does it matter if you're
it
enjoying
doesn't
it?
matter
right?
at all.
We're
It
going to run
matters
this
nothing.
experiment tonight.
I mean,
Okay, I've got this little thing I want to try.
Yes.
Yeah.
No.
And then, like, everybody's let down. Oh, you've just been peeing on me all this time.
Because I have
I
noticed.
thought it was
mean,
like this great lover making you squirt, and you've just been peeing on me.
but I have noticed.
But
like,
most women don't squirt.
having a full, like a bladder that's like a little full, like I've noticed, like I can
More pleasure?
orgasm easier.
Oh,
you
wow.
know?
Yeah.
So
Me, on the other hand, if I have to pee, that's
Yeah.
all I think of. Oh,
Yeah. I would say I'm the same too. I'm like,
gotta
I
pee.
can't have sex with a full
No.
bladder.
I'm like, sorry.
'Cause I
I'm
think
like,
you're
sorry, we're
afraid of
stopping. Gotta go pee.
This is not going to be fun for me because I have to pee, and I'm going to worry, but I'm going to pee. This is not good at all. And he's like, what? But sorry.
I mean,
sorry.
come on, hasn't your dream always been a golden shower? I mean,
Now we're getting into a whole another level of confessions here, clearly
Right,
speaking. But
It
I want
is a fetish. Some people like that.
yeah,
true.
yeah. There's somebody who's got some videotape on somebody very important about that in our
Yes.
current administration. But anyway, my question to you was, I wanted to kind of tie it all together with like the vaginal rejuvenation, the labiaplasty, the shaving, the embarrassment to talk about, this is going wrong, or in your experience, or women like having sex just for pleasure, and how's not and sex to be pleasurable, not just not painful, right?
Right.
So how do you
Approach that.
approach it, encourage, let them get to that point, but be comfortable? I'm just curious.
Yeah. So I definitely believe that sex should be pleasurable for both people. And part of the way that I explain it is that sex is selfish and selfless. It's like the most selfless, selfish thing you'll ever do, because you are having sex because you care about your partner, you're giving to your partner, but by the same token, you want your partner to take care of you too.
Right.
And it goes both ways. So it's okay to be selfish, because I feel like some women are like, oh, okay, he came and now it's over, and oh well. No,
he's hungry.
it doesn't
He's
have to
gone
be
get
that
his
way.
sandwich now.
Yeah.
It doesn't have to be that way. Or it doesn't have to be that way. Like, it's a turn-taking thing, and your pleasure is just as important, because I see a lot of women for low libido, and I ask about orgasm. Do you reach orgasm? No. Does he try and help you reach orgasm? No. And I just tell him it's okay if he does try. And I'm like, you got to get something out of this for you to want to have sex. If it's just like duty sex, or you're like, oh, I know he needs it because he's a man, your libido, you need to like...
It suffers.
It suffers, because you're not really getting anything out of it. So I do think that sex should be pleasurable for both parties. That's the beauty of it. And if you're not getting what you need, then you need to figure out a way to let your partner know that your pleasure is important also.
Okay. But let's say you've got a partner who's selfish. Doesn't matter what you say. Masturbation. Mm-hmm. Everybody does it. Does that help for a female, a regular masturbation? Does that help her sexual health?
Yes, because every time you reach orgasm, you bring lots of blood flow to the vagina. As far as, so what I think about masturbation is women do it, they just don't talk about it. Mm-hmm. Men brag about it, they talk about it nonstop, but women, they don't talk about it. And we're sort of taught in our society, oh, that's bad. Women don't do that, and that just drives me crazy. But women masturbate. So if you masturbate and you're feeling guilty about it, don't feel guilty. Women do it.
Right.
And it's absolutely okay to
we
masturbate.
Don't need
it feels good.
We don't have to announce the fact that, we're having sex with ourselves 5 times a day like men do, So I don't know, somehow it's like, I've done it 5 times today. Yeah. I came 5 times all by myself. It's like, really, you're announcing to everybody that you had to orgasm 5 times by yourself today?
But to think that there's actually a health benefit to do that, to bringing that blood flow into okay, now I'm like, oh, well, maybe I need to go and...
So actually there's other health benefits because when you reach orgasm, your brain releases a flood of dopamine. And dopamine is a neurotransmitter, a protein that's in your brain that makes you feel so good. So it's the same neurotransmitter that's released if you do heroin, that euphoric feeling. Don't go do heroin because it's completely addicting. But, that rush of dopamine makes you feel really good. And so you get a huge benefit. And the other thing that happens when you reach orgasm is that you release oxytocin, which is that bonding hormone. So it brings couples close together. It makes you want to cuddle, it's just like, So there's so many benefits to reaching orgasm, whether in a couple or even by yourself, just that good feeling. It helps relax you, takes away some of the anxiety, some of the stress at the end of the day. So there's plenty of reasons to masturbate. And some people do it to help them fall asleep or to relieve stress.
Right.
Women don't talk about it.
When we don't talk about it, but it's okay to talk about it.
Absolutely.
And here on Clearly Speaking, we will talk about that and a bunch of other things. But I just find that, why should all the pleasure in our society be about the man? Mm-hmm. And we as women, as much as we love to have sex with men, right? We love to have sex with men, and women out too. But it should be. We
can celebrate our pleasure,
right?
Absolutely,
right? Yeah. Well, on that note, this has been tremendously pleasurable having you here, Dr. Lynn, and I know that we'll
have you back.
Definitely.
Fantastic. I will absolutely come back. This is so much fun.
Thank you.
And I think that you also have your own channels where you share information, right?
I do.
Can you tell us a little bit about those before we
leave? I have a YouTube channel. If you search Dr. Becky Lynn on YouTube, and basically I've created it just to provide education to patients, to other practitioners, because we really don't learn about sexual health as a medical student or a resident. So, providers sometimes feel really ill-equipped to handle this. And I say a lot of the same things over and over again. So I decided to make videos so patients could go home and watch them. And what happened was I really made them for my patients, but the partners watched them. Absolutely, because a woman will come home and be like, the doctor said this. Here, look, you can watch her saying it, that I'm totally normal. There's nothing wrong with me. This happens because of this.
This is why I have Crisco in the bathroom.
Exactly. I'm not crazy.
I have not.
She did tell me.
It's not early onset dementia. I am not baking cookies. It's for a reason. I have the Crisco in the bathroom. Because Dr. Becky Lynn said it on her YouTube channel.
That's right.
Yeah.
And then I do Instagram and Facebook and Twitter, and I often post interesting articles that just have to do with sexual health. I also am a sexual counselor, so I like to post things about relationships because you really can't be a sex doctor per se without addressing the relationship. So I, post interesting articles just about dealing with long-term relationships or how to manage fights that spiral into oblivion, just things not just related to the physiologic aspects of sexual function. I like to incorporate the relationship as well. So my Facebook is Women's Sex Health MD, and my Twitter is at Becky K, like kangaroo, Lynn.
And we'll have
Great.
those links on our website.
We will, and we will make sure to follow you and certainly share things along the way.
Fantastic.
So, thank you so much for
Thank you for
joining
coming.
us.
Oh,
It's
thank
been
you so
really-
much for having me. This has been really great.
We'll have you back
Yay.
soon because we
Yeah.
always have questions.
Cheers,
All right, cheers.
everyone. Thank you.
Of course, the lush over here has, a half a sip left.
All right.
Yay.
That
Well,
was
that was fun.
really fun.
Yes.
It was a real wide mix of things, which is great. So,
Awesome.
yeah, thanks so much for coming.
Sure.
And we will definitely. So you women's. I wrote it down. So your Women's Sex Health MD. What was that? Was that YouTube or which one was that?
Women's Sex Health MD is
This is Facebook.
Facebook.
At Facebook. Okay.
Follow me?
Yeah.
Okay.
I
And
do.
your
Hysterectomy, worse than my colon cancer. To recover
Really?
from that abdominal surgery.
kind of thinking like
Because William
Spot, right? So they've done studies where they've dissected